Well, there are now 7 people that have tested positive for coronavirus here in South Africa, all among a group of 10 who returned from Italy at the beginning of March. For the very latest, we're joined now by senior epidemiologist from the National Institute of Communicable Diseases, Sibongile Walaza. Dr. Walaza, thank you very much for joining us. How sick are the 7 that have been identified with coronavirus?
Okay, so unfortunately they've been all with mild symptoms, so it's been good.
I was reading in The Witness this morning, they interviewed patient 0, as we're calling him, and he went through all the systems and was tested, his temperature was taken, but he was absolutely asymptomatic. So it is possible that there are more people in the country who've sort of been checked and tested, but they didn't show up. How concerned are you about that?
Okay. So maybe just talking about patient 0, I mean, he did have symptoms. He did present with symptoms. But
yes.
Then, as you say, that, I mean, they've been mild symptoms as well. Well, just like with any other infection, I mean, you do get people who are asymptomatic, and especially, I mean, it also depends on the age, but then in terms of whether they're able to transmit the disease or not, at this moment, the information is still a bit sketchy. We're still looking into that.
Can we avoid community spread in South Africa, or is it inevitable, ultimately, in your view?
Well, again, as with any outbreaks, that's the main objective, first of all, is to try and contain the spread, that it doesn't go on to community to spread, and that's what you aim for. But again, it depends on how infectious the condition is and how quickly you find it. But I think you still have to try, but also not forgetting to plan for a situation when you do have community spread.
I was wondering, I think one of the big concerns globally with health authorities is it's so hard to know everything about this new coronavirus, and things do change. We've seen the fatality rate move up a little. It was originally just under around 2%. Now it's up to about 3.4%. And then if you look at what's happening in Italy, I mean, that entire country is now on lockdown. But percentage-wise, it looks like they've had more deaths compared to the cases. Is this a disease or a virus that we're still getting to grips with? Could the fatality rate jump?
So, I mean, you're saying it's a novel, so it's a new virus, so we're still learning about the epidemiology of the disease. And yes, so things are bound to change. But then in terms of the mortality rate, sometimes also it depends where you're looking, because at the beginning, especially if there's a varied type of presentation, and the focus is mostly on severe illness. So people who are going to be admitted will be those ones that are severe illness. And then again, if you're only looking at those, I mean, already they're starting off with the severe illness, then the mortality goes up. But then if, again, you look more broadly and you also include the milder cases in your denominator, then it's bound to go down. So at this point in time, I mean, it's still possible that it will still go down as well. I mean, when you get more people into the pool with milder illness, because then you'll have a bigger denominator. So it can still be lower than what is being quoted.
Would you recommend that South Africans go and get the flu vaccine? Does it help prevent coronavirus? Because we don't have a vaccine for coronavirus, COVID-19 yet.
Mm-hmm. Correct. So we don't have a vaccine, but it is important. I mean, the symptoms are that look like is flu-like symptoms. And again, this is just going to be our influenza season. So we'd really recommend that people do go out and get an influenza vaccine. It will not prevent the coronavirus, but it will prevent the influenza. And again, we found that with the coronavirus, the people who are more at severe risk of dying are more or less the same as those who are prone to severe illness with influenza. So if you already take out the influenza out of the equation, it will be better for the community. So I would really encourage people to go and get the influenza virus.
So it will help with will help with your immunity, and you could probably withstand the impacts of the disease.
Exactly, and also just again take out the panic of saying, is it coronavirus, is it influenza? Because then if you've already have a flu vaccine, then
how long do you think we're going to be battling with COVID-19? Already we're seeing in China it's tailing off. Is that the natural trajectory of a virus, or is that because of human intervention in controlling the disease?
It's a combination of things, and again, what we do in terms of prevention does help, and again, also sometimes it's the virus itself. Then again, if there's a possibility of people being reinfected again, and if it continues being part of the virus, that it continues. For an example, with SARS in 2002, after 2003, we didn't have any more SARS, but with MERS coronavirus, it has continued. The Middle East is still seeing cases since 2012. So for this one, we're going to have to wait and see what happens.
Is it mutating?
Most viruses do, that they do mutate, but then sometimes the changes are just so subtle and small that it doesn't really impact much in terms of the presentation. And again, it still is a new virus, so we'll still have to watch what it does.
We are constantly being told not to panic, but we're also not holding hands, we are not shaking hands, we're being very, very careful. How do you assess the sort of South African response to this? Do you think that we're panicking a little too much, or do you think we're getting it right?
I think there is a bit of panic out there, and again, with just people responding to the information that they get. But what is important, I think, a message to send out there, that is, most people, there's something that everyone can do to prevent themselves getting infected. For an example, if your child is sick, again, just with any other infection, please keep them at home and they don't go to school, or the person is sick, don't go to work, because then you're going to infect others. And again, in terms of workplaces, just make sure that there are things, facilities for people to hand wash, frequent hand washing. I think if you send out, messages that help people to do something as well, there will be less panic than if you just people feel disempowered that there's nothing they can do about it.
Absolutely. Thank you so much for coming into studio this morning. That is Dr. Sibongile Walaza of the National Institute of Communicable Diseases.